afternoon, everyone. Hey, Onco Congress, Suman here again. And I believe you guys are doing well in your cancer journey. I know it is not easy to go through this journey, but we are always there as Onco Congress, your support group. And I am Suman Singh, your community leader, to be here to provide you all kind of information based on your various stages in your cancer journey. And also, I'm like me and my team of Livlong. We are there to support you with various expertise connect. Today, again, we have come with a very amazing topic, which is like very much part of our cancer journey. So when we go through our cancer journey, we go through various side effects along with radiotherapy, surgery, and chemo sessions. So it is quite related to physical, side effects that is like stiffness and pain and fatigue, where a very important expertise can help us. Onco physiotherapists, who are they and how they can help us? What are the benefits of cancer rehabilitation technique? Today we are going to discuss on same, and I'm very happy to introduce you great expertise in the same field. Her name is Dr. Dipal Shah from Ahmedabad, and she is not only having an experience of great experience of almost 18 years in this field, but also she is associated with various corporate hospitals and various organizations. She's also having her own clinic center of physiotherapy and cancer rehab. So welcome, Dr. Dipal Shah. Thank you for being here. And would you like to share something which I have missed?
No. Hi. I think it was the introduction is, I don't think I need to add anything in it. Thank you for this lovely introduction.
Yes,
and good to see you. Good to see you all. Good afternoon, everyone. So as Sumanji said, myself, Dr. Deepal, and I have done masters in cardiopulmonary conditions and also cancer rehabilitation I have done. I'm a specialist in that also. And I'm practicing since around now 20 years. So I have worked with different corporate sectors and hospitals, and now I'm based in Ahmedabad and running my own clinic. So now since many years, I'm just focused on cancer rehabilitation. So this is my area where I'm very much interested to create awareness as much as do my best to deliver the best to the patients who are in need of this therapy.
So, ma'am, like, as you said that you are now, you are getting passionate towards this cancer rehabilitation. So what is this cancer rehabilitation, and what is the role of of it in our cancer journey?
Yes, so we all know nowadays a number of cases the cancer has we see all around us, like in our nearby family, friends. We come across many patients who are suffering from cancer. So the number of cases have increased at the same time because of the awareness that has been created and early investigation and diagnosis also. Patients are, it is not like when it is diagnosed, it is too much, time has passed in the process, or it is too late, or it is an advanced stage cancer where we cannot get rid of it or cannot cure the cancer. Nowadays, in early detection, the treatment also has been very advanced, especially in India also, because many foreigners are coming to India for cancer treatment. We have seen that
tourism
also.
Is really booming right now.
Yes, right now, because we don't waste time in that investigation and diagnosis waiting period. We don't have. So as soon as there is a suspicion, within a day, like patient can consult 2 or 3 oncologists or oncosurgeon, and next within a week maximum, their treatment is almost started. So the awareness has increased, as we can see. So what happens is many survivors, number of survivors has also increased. And cancer is such a thing where, we all know that surgery or chemotherapy or radiation, these are the treatment parts. So what happens is treatment is done. Now, the quality of life of a cancer survivor depends on how physically and mentally fit the patient is, right?
Yeah.
So the survivor, maybe during the treatment or even after finishing the treatment, there are many factors or side effects are there, as you mentioned, which can affect their quality of life. So earlier, what was the scenario? Like patients used to think, okay, this is my life. Now I have survived and I have to live with this side effects,
Yes.
right? So the cancer rehabilitation basically is a supportive healthcare, a treatment plan, which helps you to stay as active as possible. So you can participate, you can remain as active as you were before cancer, in your family, in your work, in your career, or whatever you want to, pursue in life. So it doesn't make you stop, or doesn't make you, dependent on others to lead your
Physically, you
life.
mean to say, right?
Yes, exactly.
Yeah.
Cancer rehabilitation actually is a teamwork where there can be many professionals involved,
Oh,
like physiotherapist, occupational therapist, speech therapist,
oh, wow.
nutritionist, psychologist mainly,
Oh, wow.
because your mental health is also,
So like it's a whole unit.
yes,
Yeah.
exactly. It is a holistic approach actually. I think the team leader can be a physical therapist,
Okay.
because obviously psychologically also the patient needs the counseling and all the, guidance and support to go through this journey of cancer while they are undergoing treatment. So it is a teamwork, basically, cancer rehabilitation, where we make sure that you remain as independent as possible, and we make you as active as possible, like you were before, and you can continue your life with same quality. You can live your life. So that
Wow.
is the main goal.
So that's the vision, and it cannot be completed individually, but led by the onco physiotherapist and the other expertise along with them to guide.
True.
So the
Yes.
whole unit is the term, like, representing
Yes,
cancer
exactly.
rehabilitation.
Yes,
So
exactly.
this is what we require. So ma'am, like as you said that it is a part of our journey. So like what kind of cancers, like what are the common cancers which are associated, and you think that these type of cancers like need more of this kind of activity, like, in their journey, like including physiotherapy. Yeah.
Right. So nowadays, if we see, especially in India, breast cancer, then head and neck cancer, like mouth cancer, oral cavity, or the tongue, or the jaw, or the neck area, these cancers are in very much rising cases we can see,
Yes.
especially in young people. It is not like after 50 or 60 the cases we see. So, and also lung cancer. So
Oh,
these three cancer, head and neck cancer, breast cancer, and lung cancer, these three cancers are like booming. And many young females, like in 30, 35 age group of females who are even single or just, married, not
yeah.
even a mother, or mother to a very young child.
Earlier there was a saying, ma'am, like 40-45 में देखो, पर अभी मैं देख रही, जैसे आप बता रहे हैं, even I am observing in our support groups or when I interact with patients, then how come, like, is it also possible for the teenage to get this kind of like a
Very
diagnosis?
rare,
Very
unless they
rare.
have,
Okay.
very strong family history.
Okay.
Otherwise, like blood cancer or skin cancer, or some of the cancer are very common at very young age.
Okay.
Sarcoma and all that, bone cancer. But breast cancer mainly, earlier it was in 40s or
Yeah,
50s.
yeah.
Now it is coming in 30s.
So like
So
we
it
have to be like in late 20s start कर देना चाहिए अपना.
exactly, and the treatment part is excellent for breast cancer. It is like considered as safest so far. But then you are too young, you are in 30s, you are just maybe married, or baby is hardly very young, hardly 5 or 2 years old. So you have your whole life ahead of you, your work, your career, your family. So at that time, it is very much important that you maintain your physical and mental well-being.
My God. So, ma'am, like when we are going through a journey, like, we have gone through the surgery. So, like, is it possible to continue with the physiotherapy sessions along with the treatment journey? Uh,
Very much, and very much important also.
is it?
See, cancer rehabilitation also has phases. So if I say from my perspective or my role as a physiotherapist, I would suggest, or the even experts in oncology treatment part, the patient, as soon as it is diagnosed and patient is going for surgery or whatever treatment is planned, before starting that also, they should take one, they should, start physiotherapy. At least take one session, one consultation, so that during the treatment, it becomes easy for them. So it kind of, preventive role is there. For some of the side effects, if you start as early as possible, it is very much effective. So preventive physiotherapy is also there, where you can start even before your treatment starts. And during the treatment part also, there are some aspects. So it is very much individualized, depending on the age and all the other factors involved, condition of the patient, overall health of the patient. Suppose some patient is already cardiopulmonary condition is not that good, or they have the efficiency is low, then after cancer treatment, it is going to deteriorate further,
Yeah.
right? So they will become dependent more and more during the early stage of treatment also. So if they start at least some of the basic techniques or physiotherapy, it will help them to go through the treatment part.
So, ma'am, in case if we do not avail this kind of therapies, what kind of side effects can occur in what type of cancer? As you mentioned, these are the common cancer, where it is really important for us to have physiotherapy. So suppose in breast cancer, as we go through this surgery of lymph node, so suppose if we don't go through such kind of exercise and therapy, what side effects, or as you said, cancer of neck and head and these lungs. So what side effects may occur if we don't take it seriously?
Right. So basically, whenever you go for surgery, I think immediately after surgery, also in IPD, some of the care or advice is given related to physiotherapy, related to your movement. You must have done this,
Yes,
go for shoulder movement to prevent the shoulder stiffness, because your breast or the lymph nodes are removed. So it is, and drains are there.
Yes.
So there are chances that your shoulder and
becomes very
neck,
hard and heavy and sun ho
Exactly.
jata hai pura. You don't feel sometimes. I still struggle with that. So like,
Right.
am I supposed to do this whole life? Like,
For maintenance, yes. If it is
Okay.
better that you keep on doing it, you continue it, but it is not going to, at least it is not going to deteriorate, It is not going to give you the stiffness now.
Oh,
What happens is, if you have not done movement or physiotherapy at all during the initial days, then you must have seen, see, after surgery, the first side effect is shoulder
yes.
stiffness, right? So gradually there are days when we start mobilizing shoulder. So from the first day, we start shoulder mobilization. With drain also, with support, they are advised to do some supportive shoulder movements. Okay, so that is the first thing. And when after discharge, and if you are going for, if lymph nodes are removed, which are removed for biopsy also, right? You must be knowing that
Yes,
it depends on how many lymph nodes are removed.
Yeah, mine 10 lymph nodes were removed. Out of that, 3 was infected. That's how my treatment was planned. Yeah.
Right. So it depends. If more lymph node involvement is there, then surgeon removes the number of lymph nodes are removed, depending on the condition or diagnosis. So when lymph nodes are removed, then the lymphatic fluid, which is drained from the hand towards the axilla in the lymph nodes, it is affected. So lymphedema is the major complication after breast cancer surgery.
So what exactly happened when these side effects occur? Like,
So
I've seen images of So like, does it happen like that? Like,
Yes, it
becomes
happens like
swollen up?
that. If lymph nodes are removed, then 80 to 90% chances are there that sooner or later you may develop lymphedema.
So we need to take physiotherapy
Exactly.
seriously.
Yes. So as
Minimum
soon
how
as
many
you
sessions, ma'am, we should take like initially?
the session depends on the stage of lymphedema. But if it is in preventive stage, like immediately after surgery, within a month, if you have started and the swelling has not started coming, lymphedema is what? Swelling of your arm.
Yeah.
Okay, sometimes the swelling will be more in the wrist area, sometimes in the forearm, sometimes in the arm, depending on the condition. But if swelling has not started coming, then there are preventive exercise plus lymphedema sleeve. If you have heard about it,
Yeah.
the sleeve kind of what you can say, sleeve comes for lymphedema, which gives compression.
So ma'am, it is
So
available in retail sector?
everywhere, every medical store, or you can buy it online also.
Mhm.
But first, under consultation of an onco physiotherapist. So after surgery is done, if your lymph nodes are removed in a remarkable number, like if it is removed, just 3 or 5 lymph nodes are removed for biopsy purpose, then it is fine. Otherwise, you have to wear the lymphedema sleeve so that you can prevent lymphedema.
Oh.
And along with the sleeve, there are some kind of exercises that you have to carry out. Then you can definitely prevent the lymphedema. Then again, there are 4 stages of lymphedema. So up to the 3rd stage, physiotherapy helps very well, unless it is the last 4th stage where the fibrosis has happened. The swelling has become so hard that we cannot drain it out,
Okay.
So till that time, physiotherapy can easily help you to manage this lymphedema. There is no medicine for lymphedema.
Yeah.
So
So like,
this so you have to take physiotherapy, and role of oncophysiotherapist is very much important in lymphedema management. Only one session by a oncophysiotherapist will save you from this complication. Only one session also.
okay. So ma'am, as you're talking about this, is it possible to have a home visit for an expert? Like, can we do the sessions within home? Or like
Yes,
we
yes.
have to visit the center during this time? Like,
See, for
what can be
lymphedema,
done?
both can be done. For lymphedema, there is a machine called lymphapress, which can be, and there is another option for that also, which you can keep at home also. Intermittent pneumatic compression. The device you can keep at home and you can use it on your own.
Oh,
So that is also available. Along with that, if you carry out exercise and you don't need to go to clinic, you can do online session also, where physiotherapist can guide you how to do it.
okay. Or they can visit home and they can help
Home
you.
visit is always there. They can
Yeah.
avail that facility also.
And while we are going under the treatment, we can also opt any other optional, like outside the hospital, any clinic
Any
for the
any clinic
physiotherapy.
would be fine, but make sure that they have knowledge about cancer treatment, and they are in coordination with your oncosurgeon or oncologist.
Okay.
That
They
is
need to
very
know your
important.
history. Yeah. Yeah.
Exactly, your overall health condition also, and there are oncophysiotherapists who are specialized in cancer physiotherapy. So if it is possible, then it would be better if you consult them first
So what
and
is the
take the
difference,
guidance.
ma'am, between the oncophysiotherapist and the normal physiotherapist?
See, with cancer patients, there are some limitations. You cannot go aggressively like you go for other patients, And lymphedema now, every physical therapist or every physiotherapy center may not have those trained physiotherapists for lymphedema. For lymphedema, there are specialized therapists.
Okay.
So at least you have to take guidance from them, and then you can, in coordination, can work with your physiotherapist. But immediately, if the patient goes to any random clinic and start their treatment, it is not advisable actually.
So for a cancer journey, we need to ensure that oncophysiotherapist should be consulted. Like
Yes,
you.
exactly. Exactly.
So, ma'am, like during palliative, cancer has various stages. So the very last stage where like it is a palliative stage where like, so like, is it possible for the patient to avail this physiotherapy sessions, or how much it can benefit during those stage? Like what ease can be given to the patient using this?
Right. So in palliative care, as we all know, our main goal would be to provide them comfort
Yeah.
as much as possible. And I would say make them as independent as possible. Like they can, at least participate in their daily living activities, right? So they don't have to be bedridden totally. And we provide some support, like if they have some pain, we have some modalities which can help to relieve pain. Then if they have, like mobility issues, then there are some supportive devices like kneecap or sleeve or belts or walker. Things like this can help them to be as mobile as possible. So we can give this supportive treatment and give them some comfort and pain relief during palliative stage.
So
And
that
also
does help. That does help to ease
yes,
the
I
pain.
have many, I'm associated with an NGO where they take care of this palliative care patients only. So I visit them and just do this little bit of help so that they can be as mobile or as pain-free as possible.
Ma'am, what kind of the physiotherapy is associated with, as you said, head and neck? I'm very curious because
Yeah, that was I.
I'm not I do not have any exposure towards that. So just for my knowledge and my fellow warriors who are going through this, because we've only heard about lymphedema, but I've never heard physiotherapy session related. This was a kind of enlightenment to me that there are physiotherapy sessions for head and neck cancer and lung cancer. So would you like to elaborate that?
Yeah, sure.
Enlighten us?
Sure. Sure, I was going to come to that also because
Yeah, I'm very interested to know.
number of cases are like increasing like anything, head and neck cancer, tongue cancer, oral cavity cancer. So what happens is the affected part is removed and plastic surgery is done. So the flap from any of your other body part like thigh or forearm, say they take a flap and they um, do this plastic surgery. So your face may look like normal only. The surgery has been so advanced and superb that you sometimes you won't even be able to make out that this patient has undergone
Such a
surgery.
professionalism,
Yeah, very good, very nice touch. Yes, cosmetic surgeries are done, plastic surgeries are done at the same time mostly. So what happens is when some part of teeth is removed, jaw is removed, or tongue is removed, oral cavity is removed. So one part is definitely affected. Now the main problem they encounter is mouth opening.
Okay. After surgery, you're saying, yeah.
Exactly. So what happens is along with that radiation, I was going to mention this in breast cancer surgery also. Whenever you go for radiation after surgery, then you must have seen that because of radiation, fibrosis happens. The tissues become tight.
Yeah.
So after surgery in breast cancer also, all these muscles and tissues become so tight that it leads to stiffness of your shoulder and neck also.
Yeah.
So at that time also, during radiation also, or at least as soon as radiation sessions are completed, one must start physiotherapy. Because once the fibrosis or the stiffness, advances, then it becomes very painful and difficult for patient to use this shoulder.
Ma'am, don't remind me of that.
So if patient thinks that
bad.
if it is paining, I should not move it, right?
Yes, it's very bad. Yeah.
Then later on, it becomes very difficult for them to move this shoulder. So same happens with head and neck cancer.
Okay.
Now they have this stiffness of mainly the neck area and mouth area. So the mouth opening is the number one major difficulty they face. So after radiation is if given, then it becomes more stiff. Tissues becomes more tight. So head and neck cancer patients need to do this neck mobility exercises and mouth opening exercises. So we have devices also, jaw stretcher, if you have seen. I think I have one.
For
I'll
me,
show
this is
you.
an if you have, ma'am, we would love to show our members also, support group members for watching us. Okay.
See,
Wow.
something like this. This is a jaw stretcher.
So this is
So, you
something
know,
very new for me. Also, it's a very great
yeah, as soon as
exposure
they
towards this.
start, yes, using it, and also there are manual exercises where we mobilize this area and do stretching exercises, and this device help them to do this mouth opening exercises with assistance. See, you have to keep this in your mouth. Whatever mouth opening is there, it starts with minimum, like one finger only, or one, not even a finger, like this, you
You need a
insert in the
supervision
mouth.
in that, right, ma'am?
No, they can do it on their own. They have to do it home only.
Oh.
Under our supervision, definitely we make them do, but at home also they need to continue.
Oh.
So after inserting this in mouth, they have to just move this key. So it will open up. See,
What this device is called, ma'am?
jaw stretcher.
Oh, jaw stretcher.
See, this will increase, the diameter will increase gradually. So as much as they are capable of at that point, and we encourage them to do more every day. And at that point where the stretch is maximum, they have to maintain that stretch. See, this can go on and on. Because what happens manually, yes, manually there comes a limitation. Yeah. Also, patients may not feel comfortable also, and
slowly unko stretch hoga, ma'am.
Yes, slowly stretch hoga, and they have to maintain it.
So this is very important. Minimum requirement of this many sessions, like how
sessions depend, but at least for a month they have to sincerely do this exercise with this device also, and there are alternate options also. With this, we give ice cream sticks. Ice cream sticks they have to keep in mouth, and they have to keep on inserting more. Like today they are doing 10. Then again in between we insert one more. So 11, then 12, then 13. Like that we increase. So it will increase the diameter, and it will help them in mouth opening. So does this help also to overcome pain and fatigue? Yes, definitely also? Pain, because movement restriction, the main their concern is they are not able to eat. Many patients come with like they are not able to insert a spoon or a bite. Chewing issue is always there, but one side is fine, so they can chew, but they have to. There should be sufficient mouth opening, na, for they have to, if they have to eat. So if they don't do at all, then after 3-4 months also, some patients, the mouth opening is so much less that they're not able to eat. They're surviving on liquid diet. Oh my. Yeah, this is most of the cases, and this is a very good thing, ma'am. You showed us. It's like, exposure to me only. I was not aware about this. So thank you for sharing this information. This is very easily available at any, mostly surgeons or give also this device. They advise also, but sometimes patients miss, Yeah. So they should always, if you are going for oral surgery, then you have to have this mouth jaw stretcher, one. And the number 2 is this is a block, mouth block, we call it. So it is like a splint. Whatever mouth opening we have gained, achieved. So for maintenance, this you have to keep in your mouth. This is silicone, non-harmful. So this will give you the maintenance part. Okay. Continuous stretching part. So it is, I know it looks very weird, but it is. I know. But once the patient who are following this treatment as soon as possible, at least for a month, they are so happy to, gain the full mobility that they have no issues with their movement and opening. And when you can eat well, then there is nothing like it, right? Yeah. Because then they become so depressed that they are not able to eat. That also impacts us psychologically as well, like health and to recover. Physically also, yes. They don't feel well. Now I'm not able to eat this, or I'm not satisfied even. That makes us feel like we are yet to recover. It's again like not yet recovered, like Yes, they lose the hope. Okay, like now this is going to be the same my whole life, and I have to live with this, and they enter into that psychological loop.
Yeah.
but they need to come out of it with proper physiotherapy. They can definitely do well. And also the other side effect which all cancer patients may face is fatigue. You must have heard about it. Cancer
Fatigue
related
and
fatigue.
pain.
Yes, fatigue and pain. So if they go for some of the physical activities, especially aerobic exercises are always advised for cancer patients. So the cardiopulmonary endurance is maintained, like normal walking, jogging, cycling. So if they keep on doing this, then their quality of life is maintained. So that is also very much important.
That's like, quite beneficial. It sounds, and the way you are explaining, and it's like I'm really enjoying, and I would like to know more. But I know there is a limitation of time, ma'am, for you as well.
We can sure
We
continue
can
later
keep
on
going.
also. Yeah,
Definitely,
sure, I
I'll
know.
keep inviting you many more times so you can keep
Sure,
sharing knowledge.
anytime.
So
Also, I
apart
would
from
like
this,
to mention just one thing that for lymphedema, also, if you go for one session, even for
yeah,
oral
yeah.
cancers, if you take one expert session, then it will help a lot to, clear all your doubts and do better in your recovery.
Wow.
There are no side effects of physiotherapy. If there are side effects, any of the side effects, then the therapist know where to stop.
Okay.
But you don't need to worry about any of the side effects related to physiotherapy, particularly where cancer is concerned. It is not like if you do exercises, your cancer will spread. The
No.
mentality sometimes is there that my cancer will get worsen or it will reappear or nothing like that. In fact, as physically active as you are, then then chances of recurrence is also less.
So, ma'am, I'm your all this of like, journey with dealing with so many patients in your life. Like, do you find any, care gap, like when you deal with certain patients and with their journey, you might be encountering so many patients in your life. So dealing with such kind of community who is like, going through such a tough journey, do you find any gap, for them for this community, which should be fulfilled?
Like in medical sector,
In
you are
medical or emotional, or like, in terms of society giving the support. So as a doctor, from your point of view, dealing with patients, so have you seen any challenges being faced, be it emotional?
yes.
And what is the role you think of a support group can play, as we are right now as part of, the support group, and we are trying to bring, that
Awareness. You are doing an
awareness.
excellent work in creating awareness, Sumanji. So more of this, you can focus on how to improve your quality of life. There are some, as I said, patients may think when many doctors are not referring for physiotherapy.
Yeah.
They even don't, know the role of physiotherapy sometimes. So no, it is not always there that your doctor may refer you. So like for routine, if back pain, neck pain, anything is there, patients know where to go. They directly
They
go
do
to the
not
physiotherapist.
recommend on their
Exactly.
own.
Exactly.
It is
But
their call
for
to go.
exactly. So when the complication or side effect has already, patient is facing, and then they may refer. That also may refer. So there is a huge gap, I would say, for this, the
Physiotherapy awareness.
physiotherapy awareness is still, I am also creating awareness. Even patients come and say, if doctor would have said earlier, referred earlier, we would have started early.
So like when the things get worse, then they decide. So then the duration also increase for the recovery.
Right, exactly. And then it becomes slightly difficult, to recover also.
So I think
You
the
may not be.
collaboration and the communication, and as you said, the cancer rehab is all about teamwork.
So
That
as a support
also,
group, also counseling is very much required, because see, I'm not blaming doctors or
I
surgeons. They are
understand.
too busy to save your life. Definitely.
Right.
Their first priority is to save your life and get rid of cancer. So
Right.
their part is done. They have done their part. But the bridge is not there where, patients get the guidance that now what? They don't know
Very, very
whether.
important point, ma'am, you have come up with, that once we are done with the therapies, what next?
Exactly. So am I going to live like this? What are the side effects I may come across, or they may already facing some of the challenges. They may not be able to communicate also. They don't feel it right also. Like, how can I ask this to my surgeon or my oncologist? Or they are too busy to, solve your this type of queries. So there should be some bridge should be there. Counseling can be done, and physiotherapy part also. These two factors are very much important, so that physical and mental well-being of patient is taken care of.
Any message you would like to give before we wind up?
I would
Audience
love
and
to.
patients.
The cancer survivor I have seen, and I must say this, like, it is a journey. Definitely, it is a tough, difficult journey, but you can do it. Be open about it. Don't have any stigma towards it. Don't hide your condition. Whatever doubt, whatever difficulty you are facing, take help of whoever you think may be helpful. And ultimately, fighter you are. But an army of people is always there to help you in this journey. Not just doctors, but paramedical or the counselor or a nutritionist. So to make you lead a better life and improve your quality of life. So
that's like, thank you so much, ma'am, for being here and sharing your knowledge and being with us. And we look forward for many more sessions with you. And
definitely.
I really enjoyed talking to you, and you really helped me to have a great exposure towards the things which I was not aware of, because mostly, and not only me, as you said, that there is a very less knowledge about physiotherapy. So before we end, ma'am, like, what is the difference between like yoga, exercise, and this physiotherapy? Is there any difference, or they are all same? Like,
No,
they can
see,
be
yoga,
termed as one, or like there is difference, like
there is a difference, because see, physiotherapy is, we do personalized and individualized
case to
treatment
case.
plan. Yes, case to case, it is different. Like two breast cancer surgery patients, or two lymphedema patients, or two shoulder problem after radiation cases are different. I cannot give generalized treatment to each and every patient.
Oh.
There are some general, format that we have to follow, but otherwise it is individualized. Yoga is for your overall health, well-being, and
Okay.
mainly it works for prevention. Definitely,
Mhm.
when you are healthy. Yoga also I also advise pranayam to all the cancer patients, because it helps you in psychological well-being also. But physiotherapy is totally different. We have specialized treatment for each and every patient. And it is not just the machine. It is also the exercise part, the rehabilitation part, what progression to be done, when to be done, how many repetitions, how many sets of exercises, which exercises is not advisable for this patient. There may be balance issues, there may be neuropathy.
Mhm.
So each and every patient is different.
So as per their treatment journey, as per their report validation, you take a call case to
Yes,
case, how to prepare or plan the treatment or a therapy for individuals, you're saying.
yes,
So
yes,
that is the
definitely.
difference between the exercise which generally done and
The
the
proper personalized. That is why I said that don't go for generalized physiotherapy also. At least
right.
take one consultation from oncology specialist, onco physiotherapist. Then you can continue with the progression part.
So it's a great awareness for me and for sure audience who are watching there. Thank you, ma'am, because mostly we are not aware that there is a difference between a physiotherapist or a yoga. And thank you for giving us this exposure and understanding the difference. Also, we were able to understand the difference between onco physiotherapist and a normal physiotherapist, which is again a very new knowledge for me as well. So thank you so much, ma'am, for being here. And audience, I do believe that you must have definitely enjoyed this wonderful session with such an amazing expert oncophysiotherapist, Dr. Dipal Shah. And not only Dr. Dipal Shah is associated with us, we have various experts with us. In association with Livlong, this group is formed. This group name is Onco Conquerors, and Onco Conquerors means that we are not willing to give up, and that's why every step we are, making an effort to conquer each day at a time. So that's how we believe in this word, that we are conquerors. So thank you so much for being part of this group, and I believe that you are able to get whatever information you're seeking for. Feel free to connect to us. We have various experts, be it oncophysiotherapist, or be oncologist, or be nutritionist, or various experts like yoga experts, and we are trying to provide you the panel of experts as well as emotional support through this community group. And you're most welcome to call us, reach us out. So feel free to be in touch with us, and we'll keep coming with various experts to provide you great information. And also we'll keep trying to connect you with various survivors. Thank you so much for being part of this session, Dipal ji. Thank you so much.